January 4th, 2024, and this is Reporting Live with Dr. Desai. Let's get into what's going on in the community right now. We are seeing a continual increase in the number of influenza or flu cases in our community. We have to remember that triple threat that we have kept talking about, flu, RSV, and COVID is prevalent right now. What's predominating right now is the flu, and it is starting to increase significantly in our hospitals. To date, there's been more than 73,000 influenza-related admissions to our hospitals around the country. It is morbid, but we have to talk about it. Our pediatric population is also affected, and very unfortunately, we've seen, according to the CDC, 20 pediatric deaths this flu season. Let's focus on what we can do to prevent worsening disease or disease at all. Remember, we want to minimize our hospital utilization if able. So the best way to do that is to prevent disease. It is not too late to get your influenza vaccine or your flu shot. We recommend it for anybody above 6 months of age. If you have not gotten it, run today. Don't walk to get it. That's number one. Number two, COVID boosters, if you are up for it and wanting to take it, are available. This is especially important for our immunocompromised population and our elderly population, especially those above age 65. RSV, we think may have peaked already, but it is still prevalent and it can still cause a lot of complications. There is a virus available for anybody 8 months or younger, and also for our elderly population, 65 or above, or those at risk for complications. Here's another part. What if you start feeling sick? What do you do? Well, staying at home, sheltering in place, that's the lingo we use during the pandemic, but really staying at home, supportive care, getting fevers down, hydrating, taking care of yourself, staying away from others, especially those that could have complications and be more sick, is key. Do you go and get tested for flu? My short answer is, if you think you have the flu, yes, get yourself tested. You do not have to run to the ER for that. Go to your primary care physician, go to an urgent care. Several of our cities, including in the metro Atlanta area, have drive-through testing also available. The reason to get early testing for flu is that there is an antiviral medication, a pill, available that can prevent disease. COVID testing, you are never wrong to test for COVID at home using the self-test also. Here's what we want to do though. Mitigation measures. If you're sick, stay at home. Wash your hands. Distance yourself from others. If you know you're sick and you have to go out, wear the mask. You are never wrong for masking also to protect yourself. We want to keep our healthcare system afloat, keep our hospitals less saturated from these numbers. We are always here to take care of you, but disease prevention will help. It's an active process. It's an active issue. All of us need to be aware. Knowledge is power. It's Thursday, January 4th, and this is Reporting Live with Dr. Desai.